What about you ladies out there? It's an innovative surgery technique available right here in Houston. A local doctor is using brand new technology to offer a procedure for women who are uncomfortable with the way their backsides look. Joining us this morning to talk about it is distinguished cosmetic surgeon Dr. Anthony Nikko. Thank you so much for joining us this morning. It's good to talk to you. And I guess, is this an ongoing trend? This isn't to trim and make the buttocks look smaller. It's actually to give it a nice defined look, isn't it?
Yes. Buttock augmentation is the fastest growing major cosmetic procedure in the United States.
So everyone wants to have back, so to speak.
Yes. With the new fashion, the skinny jeans, and so everyone wants to show off their butt and look better.
Now you have a really interesting technique. Tell us a little bit about how it works.
Yes, we at Nikko Cosmetic Surgery Center, our main focus is body contouring. We do a lot of breast augmentation and liposuction and buttock augmentation, and we really focus on techniques that leaves minimal scars. With buttock augmentation, the first thing we do is with liposuction, we harvest fat from areas of where you have unwanted fat, and then we inject it into the buttock area to give it more volume.
So you're going to look slim and trim somewhere else and then have more elsewhere.
Right. The primary focus is to have a very slim waistline, take away the saddlebags, and take away the stubborn inner thighs, and take that fat and inject it into the buttock area.
And so minimal scarring. What are you having to do to use this? Is it like one of the little cannulas that we're used to seeing when we see this procedure?
With the traditional buttock lift, you have that scar, that ugly scar that runs in the back of the lower back. With this procedure, there is no scars whatsoever.
And it sounds like downtime might be a lot better if you're not putting any type of foreign tissue into your body.
Yeah, with the traditional buttock augmentation with the implants and the buttock lifts, I mean, you're talking about probably procedures that you have to stay overnight in the hospital, but with this, there's no overnight stay, and recovery is much easier.
And when could you be back to work? Let's say you came in on a Friday, when would you be able to get back to normal activities?
3 or 4 days off work.
Really?
3 or 4 days off work.
So it's fairly quickly.
Very quick.
I think we have some before and after pictures. If we could pull those up, we would love to show our viewers now we got these from your website.
Right.
Kind of walk us through and see on the left-hand side, we see obviously that's before.
Yeah, you can see where her waistline is much more contour, and we took the fat from her waistline and her lower back actually, and took that fat and put it into the area where she needs more volume in the middle and the lower part of the buttocks. And you can see how the buttocks also lifted. So it actually lifts not only the buttocks but the lateral thighs. And what you can see is the waistline is really contoured in, so that gives her more proportion.
Now let's talk about the price of something like this. Cost is certainly always an issue for everybody.
Yes. The cost depends on how much fat you need to take from someone. Someone may need just the fat from the lower back, the waistline, the thighs, and so it varies. But for the holiday season, we are offering a $1,000 off for our Fox viewers.
Hey, that's a big deal. So when they come in or they make a phone call and just say, I want the $1,000 off.
Yes, please visit our website, drnikko.com, and call our number, and someone will help you and come in for a consultation, and we evaluate every patient on an individual basis and depending on what their needs and their desires, and we go from there.
All right, well, we will certainly put a link to that on our website, and we appreciate you being here today to talk to us about this. Now, Dr. Nikko is also known for his advanced breast lift method. We'll hear more from him about his innovative no-scar procedure right after this break. We're back with cosmetic surgeon Dr. Anthony Nikko. We talked a little bit before about your buttock augmentation procedure. Now we're going to be talking breast lift. So thanks for sticking around to talk about this. And so many patients that I have talked to in the past have suffered some very serious scarring from this. And you're one of the only surgeons in town who makes sure that women can get a breast lift without having to suffer from those scars.
Yes, at Nikko Cosmetic Surgery Center, we see a lot of people who come in for mommy makeovers, and so after having 2 or 3 kids, obviously they lost volume in their breasts and they want their breasts lifted. But oftentimes they'll tell me they've seen 2 or 3 doctors who have told them that they have to have the typical scars on their breast, the anchor scar, and so they're not happy with that, and they're not really willing to go through that. So what we offer them is this procedure where I do everything through a small incision underneath the arm. Is the transaxillary technique, and by using an implant and using the transaxillary technique, I can lift their breasts. People with mild to moderate sagging breasts without any scars on their breasts whatsoever.
And that has to be really big for women who want to look maybe youthful or younger. What about the people who already have the scars? Can you help them and maybe perhaps help the scarring look better?
Yeah, unfortunately, once you have the scars, they're there, and it's difficult to correct the scars. That's why we do everything we can to minimize scars. We focus on procedures that leave very little scars on the breast. So that's why avoidance is really the primary treatment.
Now, what about the recovery period for something like this? This sounds like probably a more serious procedure than the augmentation we're talking about for the buttocks earlier.
Yeah, it's a little bit more downtime, but certainly less downtime than the traditional breast lift, where it's much more invasive. With this procedure, still recovery time is no more than 1 week.
You know, we're showing everyone here a little bit about what we're talking about. So again, you use the armpit, and recovery is minimal, which everyone always wants to get back to work usually as quickly as they can. And then usually within a week or so, you're back at work.
Right. Not only it's important to be back at work, but be able to take care of the little ones.
Sure.
And so we have a lot of mothers who just can't afford to take more than a week off. They can't get more than a week worth of
Now, it sounds like it's a little bit more than a lift, because you said you also use an implant when you do this?
Yes, it's a combination of a lift with an implant, because without the implant, you really can't get the volume that you want, the cleavage that you want. So oftentimes you need a small implant to give you the cleavage.
How do you decide who is a candidate? If someone comes to you and says, you know what, this is what I'm interested in, how do you know when they're the right person for this?
Yes, that's a great question. Now, it all depends on how much sagging tissue they have, and it also depends what their goals are, the amount of lift they need. So knowing what they want and knowing what the end point is, that determines what we can do for them.
So if someone says, you know what, I think I might be interested in that, the best thing would be to I guess, come see you for an initial consultation.
Yeah, if you visit drnikko.com, our website, you can see all the before and after pictures, and you can see some breasts that, you know, have some sagging tissue, and then you can see how we lift it, and you don't see any scars on it.
What about risk? It seems like there's always at least the typical risks that are involved with it, maybe perhaps infection or problems with anesthesia. Anything else that someone would need to worry about?
Yeah, you know, with breast augmentation and breast lift, the main thing we worry about is capsular contracture. I mean, all the other risks are very minimal, very small, but capsular contracture is one thing that we often deal with.
And can you explain to us what that means?
Basically, it's just an excessive scar tissue production around the implant. It happens about, 5% of the time. Yeah.
Well, that's still pretty minimal, though, 5%, I would say.
Yeah.
But it's still something that they need to know about.
Yes.
Now, what about cost of this particular procedure?
Yeah, cost is, with this procedure, the primary thing is that it's certainly less than doing a breast lift and an augmentation. With this procedure, it's actually less than the typical cost. And so for this holiday season, we are also offering a $1,000 off for our Fox Viewer for any body contouring procedures.
All right, well, people will be glad to know that with the holidays coming. Hopefully they can look and feel better than ever, and then also save a dime. Always very good information. Dr. Nikko, thanks for being here today and walking us through some of the interesting things you're doing in Houston. We're lucky to have you here.
Thank you.
Appreciate it.